Good morning, student. Myself from Dr. Indira, dealing the course Probiotics and Functional Foods, Module 1, Unit 1. So today we'll see the topic that is the minimal effective dosage. So while we are prescribing the probiotic organisms, what is the effective dose or minimum effective dose we need to give to the patients? So here the minimal effective dose or the level of viable cells of the probiotic strain in terms of colony forming units per ml per day in the carrier food that demonstrates the general health promoting functions or well-being or specific health claim in the target population should be clearly indicated on the label. So on the label of probiotic products, we need to determine the minimal effective dose of a particular probiotic strain in the form of colony forming units per ml per day. So based on the target population. So if the target population is older people, so we have to identify the specific dose. If the target population is infants and children, we have to identify the specific dose. If the population is women, we have to identify the specific dose. So like that, we have to determine the minimum effective dose on the label of the probiotic product. When determining how much probiotics per day to take, we have to identify and we have to specify the specific dose in terms of colony forming units. What are colony forming units? Colony forming units are nothing but these colony forming units are number of viable cells present in the specific capsule. So here we will measure the number of live microorganisms in a probiotic dose, and these probiotic organisms, they are capable of dividing and forming colonies. That means they are live microorganisms. They are able to divide and able to form new colonies. So such type of live microorganisms are viable, and these viable microorganisms, we will call it as colony forming units. So here, while deciding the colony forming units, we have to see some key points. So the minimum recommended dosage for adults is typically billion colony forming units per day. So if you see probiotic supplements, the dose ranges from 1 billion to 100 billion colony forming units per dose. And more colony forming units don't always mean better results. It's about finding the right amount for your needs. It's important to understand that colony forming units are not just a measure of quantity, but also quality of the probiotic organisms we need to consider. A higher colony forming unit count indicates more live bacteria, but it does not necessarily guarantee the better results. So even though it is a live bacteria, whether it is providing good results or not, that also we need to consider. The effectiveness of probiotics depends on various factors. One is the specific strains present and how they will survive in the product formulation and your digestive system. All these factors, we need to see the effectiveness of probiotics. And if you see the recommended dosage for different age groups, so generally the probiotics, the dosage varies from one age group to another age group. For example, say from infants varies, and then women varies, and the pregnant women varies, and again old people varies. So based on the age group, we need to recommend the dosage. So if you see the adults, they require 10 to 20 billion colony forming units per day. For children of 14 to 17 years age, the recommended dose is the 5 to 10 billion colony forming units per day. And toddlers 1 to 3 years age, 2 to 4 billion colony forming units per day. Infants of 0 to 12 months, 1 to 2 billion colony forming units per day. So this is the recommended dosage for different age groups. However, there are just starting points. So your ideal dosage might differ based on your specific health needs and goals. So if you take adults, for general health maintenance, most adults can benefit from 10 to 20 billion colony forming units. However, if any disease condition is there, there you have to prescribe the higher doses. So higher doses are recommended in specific cases. For example, if we take antibiotic associated diarrhea, up to 100 billion colony forming units per day, you can prescribe. For irritable bowel syndrome, 20 to 350 billion colony units per day. For ulcerative colitis, up to 900 billion colony units per day. So, general recommended dose is there for adults if anyone is affected with any particular disorder or disease. So, in such cases, we have to recommend the higher doses. For children, 5 to 10 billion colony forming units per day is a good starting point for most kids. And for acute infections of diarrhea, up to 10 billion colony forming units per day in case of the children. For prevention of antibiotic associated diarrhea, that is the resistant strains, in such case, you can recommend up to 40 billion colony forming units per day. In case of infants and toddlers, the little ones probiotic dosages are typically lower. Always we need to consult with a pediatrician before starting the probiotics for infants or toddlers. So some studies have used the doses ranging from 100 million to 6 billion colony forming units per day for various conditions in infants. While identifying the right dosage, we have to see some factors like overall health, specific health conditions, and the particular probiotic strains being used. So always we need to consult a healthcare professional or the pediatrician for prescribing the dosage for infants and the toddlers. When starting a probiotic regimen, it's often recommended to begin with a lower dose and gradually increasing the dose. So this allows your body to adjust and help minimize the potential side effects like gas, bloating that some people experience when first taking the probiotics. So taking them regularly at the recommended dose is more beneficial than occasional high doses. So like this, we need to consider or prescribe the dose for infants and toddlers. What are the factors influence the right dosage? So if you see, determining the right probiotic dosage is not one size fits all. So several factors influence the appropriate. First one is your current health status. Specific conditions may require different probiotic strains or dosages and specific digestive imbalances. In such case, certain gut issues might benefit from higher doses or particular strains. And the type of probiotic strains. Different strains have varying effects and optimal dosages. Age and overall health. Children and older adults may have different probiotic needs. And medication. Some medications can interact with the probiotic. So, your current health status, specific digestive imbalances, types of probiotic strains, age and overall health, and medications, all these are the factors influence your dosage recommendation. Thank you.